why cancer deaths is very high in Kenya. Let me explain. So, compared to other countries or other continents, the African continent records highest number of cancers, at the same time the highest number of mortality from cancer. This is not by design. It cuts across several factors: disease presentation, myths about cancer, health-seeking behavior, fragile healthcare system, lack of insurance for cancer patients, expensive cost of seeking care, especially in some countries. These are all some of the things that really lead to late presentation. So let's talk about late presentation. So in most of the setup in Kenya, patients really wait too long. They ignore the symptoms, they see blood in their stool, maybe they say this is hemorrhoids, I don't know, they're treated for things here and there. And a lot of healthcare professionals play part in this late presentation because the patient don't end up getting specialized care right away, and maybe there's a poor or index of suspicion for something that it could be more cancerous. So you end up getting treated for typhoid, I don't know, parasites, H. pylori, and so many other things, while this could actually be something else. But that could also be, but sometimes they do lead to late presentation. The other thing is someone sees fatigue that doesn't go away, weight that is unintentional weight loss, bleeding that really comes after menopause as an ominous sign, and still they ignore. In terms of the cost of cancer care in this country, right now SHA uptake is really doing very well. More and more patients are getting registered for treatment. But the fact that cancer diagnosis culturally in the African culture is associated with death, and it's a very scary diagnosis. Lots of people really just give up on hope and and end up seeking alternative medicine, spiritual interventions, and literally dying in home. In terms of taboos and cultural barriers leading to late diagnosis and bumping up this number of deaths or mortality index in the country, some of the myths surrounding really and cancer care in Kenya contributes to these deaths. For example, people they see lumps and bumps in their body, they go to hospital. Some actually do believe doing a biopsy of that and makes the tumor spread, which is very wrong. Others think radiotherapy is actually not safe, and the fact that they call it burning or kuchoma actually kind of sways some people away from that. It's lack of lack of really correct information. So you see other people declining surgery, thinking that if they do surgery, maybe they were told that the cancer will spread faster. These are all really uncalled for, to be honest, and a lot of misinformation. So in summary, the reason why we see a lot of deaths in cancer, we record around 47,000 or 42 to 43,000 per year number of new cases. Out of that, you see around 27 to 30,000 patients dying. We really can address these cancer care gaps and disproportionate incidence versus mortality numbers if we really address the three things that I talked about: improved early detection, cancer awareness, and patient education, demystifying these myths that really leads to late presentation, and improving access to cancer care by reducing the cost related to cancer care. I hope this helps. This is Dr. Omar, oncologist in Nairobi.